Thank you, Dave. Thanks for your nice introduction. I've been to Canada a couple of times over the years, and it's been quite a while, though, since I've been speaking for the Ontario Association of Bovine Practitioners, and it's good to be back here again. Thanks for joining me, and Dave asked me to come over and talk a bit on the experience that we have with the restricted antimicrobial use in the country over the last 10 years, and I'm going to share my experiences, our experiences, a little bit, first specifically on mastitis, and then the next part of my presentation, the second presentation, will be a bit on the mindset stuff. I prepared this together with Christian Scherpenzeel, who is a PhD student of mine who worked on specifically on selective dry cow treatment during the last 4 or 5 years, which is an area that I will not give too much attention to during this talk, because Ron Erskine will do that specifically in his talk. Many of you may be aware of what happened in our country, what brought the situation the way it is, that we actually have to work in a restricted environment. But just to fresh up your minds, I will tell you a little bit about that. What we've seen over the years is that the antimicrobial use in animals became much more into the spotlight, specifically in Europe, but also this side of the ocean, I think. I saw that there were some projects that were talked about this morning on improving mastitis, but also decreasing antimicrobial use. The basis of that is the overuse, the high use, or also the overuse of antibiotics in veterinary medicine, whereas humans are exposed to antimicrobial resistant pathogens that may come also from animals. There were quite some incidents on MRSA, more recently on ESBL, and you see in the news that superbugs and all that kind of stuff come into attention, and things have to be done. Specifically in the Netherlands, antimicrobial use was under the attention of the public already for years. As early as 1998, 20 years ago, the use of growth promoters got the attention, and the public or advisory committee said that growth promoters had to be banned, low dosages of antimicrobials to increase growth of meat-producing animals, and it had to be banned. It was banned in 1998, and what you see here is that the use of them gradually decreased. However, at the same time, the use of antimicrobials increased, and it was compensated, so there was much more antimicrobial use in food-producing animals, and the total use of antimicrobials increased over the years. Well, this was the effect, all kind of attention, full spotlight on antimicrobials, and as you see, not only in our side of the world. So what happened, to make a long story short, is there was political pressure. This is a picture of our parliament in our country, in The Hague, in the Netherlands, and they said, bring antimicrobial use back to where it was. So it was 1998, 1999, this level of antimicrobial use, and we wanted to go back from there to there. And that has to be done within a number of years. So 20% decrease, 50, 70%. And that was said in 2009, and the animal industry had to do it themselves. And they said, okay, you have to do it yourself, you have to pay for it yourself, you have to organize it yourself. We can also do it as a government, but then you still have to pay. So that was it. And we know that antimicrobial use is related to antimicrobial resistance. So there is a bit of common sense behind it. This is a study from Belgium, from the University of Ghent, the group of Jeroen de Wulf, and he looked within Europe to different countries using different amounts of antimicrobials, and also, so he ranked them and also ranked the antimicrobial resistance. This is over all types of animals, not only dairy or beef. And you see that the traditional low antimicrobial use in countries, the Nordic countries, Norway, Sweden, Denmark, have much lower antimicrobial resistance than countries such as the Netherlands and Belgium, where a lot of antimicrobials were used. So there is some common sense behind it. Okay, going to dairy. What's the situation in dairy? Antimicrobial use is relatively low. That's not because we're better people or we're more prudent on antimicrobial use, but due to the simple fact, I think, that the use of antimicrobials has an effect on our most important product, which is milk. If we have residues in milk, we cannot deliver it, so we use it basically as little as possible. Whereas in poultry, in broilers, and in field calves, and in slaughter pigs, that's different, because when you use it, it takes a long time before you have your product, which is meat, and there's not that limiting factor as that we have in milk. So we don't have a big problem. We don't have a big problem in the sense of using a lot of antibiotics as compared to other animal sectors. And we also have limited resistance problems. The institute, the organization I'm working for, GD Animal Health, we do animal health assistance over the country since almost 100 years. Next year we exist 100 years. And we have a big laboratory where some 200 people are working. And we've been monitoring beta-lactamase in Staphylococcus in our service laboratory, where samples, mastitis samples, milk samples come in since, well, 50 years. And we haven't seen an increase in penicillin resistance, basically. This is rough data. It's not like random samples or so. It's just what comes in our lab. But that hasn't changed over years. So we see there, at least that's not an increase. So we don't have a big problem there, in spite of the fact that much antibiotics have been used intramammary. There is something else though. There's a national institute, it's called NetMap, and they monitor antimicrobial resistance in both humans as well as in animals over the years. And in 2005 they looked at antimicrobial resistance in commensal E. coli taken from dairy herds. They did it in all kind of species and they compared that. And what you see here is the percentage of E. coli that were considered to be susceptible to all antibiotics, to all antimicrobials that were tested. And that was very good. It was like 99%. However, this was from the years 2008, 2009. There was a tendency towards developing more resistance. So when this whole thing about the ultimate restricting in antimicrobial use going back 20, 50, 70%, that was around 2009, 2010, so some almost 10 years ago. And what was seen there was that there was a decrease in susceptibility of E. coli commensal bacteria that were collected from the environment. So there was some worry there. Not as big as in other species. What you see here is the comparison in the same year, 2005, in broilers, the poultry, in field calves, and in slaughter pigs, which is a totally different situation. So the problem isn't very big in our species, but we saw that there was an increase in antimicrobial resistance. So there was a reason to take action. Another reason to take action, apart from the fact that due to political pressure we had to do it, another reason was that there was a huge difference between different farms in antimicrobial use. What you see here is some data from a colleague of mine, Tine van Werven, who's working at a university practice, the ambulatory practice of Utrecht University. And they looked at the defined animal, the animal-defined daily dosages. I'll explain in a minute what that means. But it says something about the antibiotic use on the farm. And what they see is that there is a huge difference between herds. That wasn't related so much to the size of the herds. This is back in 2005 or 2006, but there was a huge difference. So there is something to improve. Okay, we were talking back then, and I was a sort of a scientific advisor of the committee that worked on this decrease in antimicrobial use in dairy, in my case. And we had a number of points that we were taking action on. One of them was, and we had to do that, was to make the antimicrobial use transparent at the herd level. Each individual herd had to make in a robust system transparent what their antimicrobial use was. The second was to minimize the use of critically important antibiotics, critically important antimicrobials. Those are those antimicrobials that are also used in a hospital to treat people in critical situations, people in intensive care and that kind of stuff. And we never gave any attention to them. Not we as veterinarians, not farmers, not the pharmaceutical companies, they were just used. And one of the things that our political system wanted is to decrease that. They were third choice antibiotics, so to say. You can only use them in certain specific situations. Okay? The third point was to decrease the intramammary use of antimicrobials, so we had to decrease the total antimicrobial use, and the thing to focus on was intramammary, because most of our antimicrobials were used intramammary. There were a few other things, like the use of antimicrobials in young stock, but I left that out for this presentation. In calves, in young calves, we use as much antimicrobials as they do in slaughter pigs, because there's no product there where the residues go to that has an influence on our behavior. So the first thing was to make antimicrobial use transparent. The government, they installed a veterinary drug authority, which was called the SDA. It's a Dutch word saying it's an authority, and it's on veterinary antimicrobials. And what they do is that they monitor and evaluate the national trends in antimicrobial use. And they report to the government, to the Secretary of State, and say, okay, it's going good or it's going bad. They also set benchmarks for the specific species, for the specific sectors. They set benchmark and say, okay, this is good, this is too high, and this is somewhere intermediate, and you have to take action, yes or no. They work based on this ADDD, the Animal Defined Daily Dose number, which is a calculation that I'd like to explain you, but doesn't add so much to my story at this point. But it is the average number of days an animal is treated during a year. So each herd has an antibiotic number, which is the ADDD. And every farmer nowadays, and I'll explain that in my second talk, nowadays every farmer knows what his antibiotic number is, what his ADDD is. It's an important number, like bulk milk somatic cell count, like calving interval, like some of those critical important parameters that farmers and the veterinarians do know. So the veterinary drug authority, they calculate it, they do the evaluation, the monitoring, and as a sector we have to deliver the data to them. And based on that, they come to their conclusions. What they also do is that they identify the problem herds. So here you see the results of the last year on the animal defined daily dosages. Here is the big group, it's somewhere little above 2, and then there's a group that has a bit of too high number, and the SDA says, okay, if your ADDD, your antibiotic number is above 6, you have to do something. And then you get a year time to change things, and if you're still above 6, then you get problem in delivering your milk. Okay, so that's about transparency of antimicrobial use. The second thing is the critically important antimicrobials. As I said already, these are those antimicrobials that you also want to use in hospitals. And here they are: third, fourth generation cephalosporins, fluoroquinolones, the long-acting macrolides, and also polymyxin B and E, cholestyne if you like. And these products were used a lot. They were used a lot because they are zero withdrawal products for some of them. And for that reason, we had no problem with the already mentioned residues. There were some studies done on these products from the UK, and our group that I'm working with also did some studies on that, and we looked at the use of these third and fourth generation cephalosporins as related to the finding of ESBLs, the extended spectrum beta-lactamase E. coli in dairy herds. And the interesting thing about these risk factors that we found here was that not so much the total antimicrobial use was related to the prevalence of ESBLs, because there was no relation there, whereas the specific use of these third and fourth generation cephalosporins was related. And that was exactly the finding that, a little bit in another approach, but exactly the finding that the UK group also found. So there definitely is a relation between ESBLs and the use of this type of antimicrobials. So they were no longer allowed in our country. You can allow them only in very specific, you can use them only in very specific situations if there really is no other choice, and after you've done sensitivity testing showing that the pathogen that you want to fight is sensitive to these products. And what happened was this, that the sales of third and fourth generation cephalosporins in dairy herds from 2012 on enormously decreased at once. It was a law, you couldn't do it anymore, you couldn't use them anymore, and it disappeared. Nobody had ever problems. There were many farmers that told me and others who had been advocating this use because it was a sort of a sensitive or sort of smart idea to use products where you have no risk of residues in milk. But farmers sometimes said, okay, we never knew that these were so important antimicrobials. Why didn't you tell us? And we didn't. We didn't as veterinarians. We just left it and thought, okay, it was easy and good to use, never realizing what consequences possibly could be in the future. Anyhow, once this was out, it worked very good. Antimicrobial use. Why specifically intramammary? Because approximately 70% of antimicrobial use is intramammary, including approximately 25% for clinical mastitis, which leaves a big part for dry cow therapy. We found that there is, or you can find that there's huge differences between countries and also within countries in the use of the antimicrobials. People from Belgium that I work a lot with recently did a study, Christina Stevens, that in Belgium nowadays still there's 40% of antimicrobial use is still critical, important antibiotics. So there's something to gain in different countries, but you also can gain. First on treatment of lactation. It's, I've been in, Dave already said, I've had different jobs during my career. One of them was that I was 15 years in private practice, and an often asked question is, what is the best antimicrobial or the best antibiotic to cure this case or these mastitis cows? And don't you have a stronger antibiotic to treat it? Whereas we know for a long time that the type of antibiotic that you use to treat clinical mastitis is not very important in cure. There's a lot of energy put into that decision, but it's not a very important parameter in predicting cure. Much more important is the height of the somatic cell count prior to onset, the number of infected quarters, the age of the cow, so basically the duration of the intramammary infection. The longer an infection, the longer a pathogen has been into the quarter, the harder it will be to cure it. And it doesn't matter that much which type of antibiotic you put into it. The question is focus on early detection. The less time a pathogen has had to spread itself within the udder, the bigger the chance will be that you will cure it. So the ban on these third and fourth generation cephalosporins, and then we're talking products such as Cobactam, etc., didn't have a big effect on this. People could still treat their mastitis cases. There were enough products left. Another thing, and I didn't go in too much detail in it, but another thing that's coming up now in our country is the choice between first, what they call first and second preference, first and second choice of antimicrobials. The basis of the antimicrobial approach in our country is that you use basically only first choice, first preference antimicrobials, which is small spectrum. That's our preference over second choice, which is wide spectrum. And then the third choice, if there's no other option, you come to the critically important antibiotics. We used to have no first preference antimicrobials available on the market in our country. The best choice was second choice, and that were wide spectrum antimicrobials. What the pharmaceutical companies did is that based on knowing that the law said that if you have the possibility to use small spectrum, that you should use small spectrum. So what they did was that they brought on the market small spectrum antimicrobials. So nowadays we have to differentiate between first and second preference mastitis tubes, such as cloxacillin, benzylpenicillin, versus the second preference, which are wide spectrum, and that is amoxicillin, clavulanic acid, lincomycin, neomycin, cephalexin, kanamycin. So if you have a mild or a moderate case of mastitis, you first have to use those first preference mastitis tubes. And most of the times that will work, because it will be staphs and straps, and they will be sensitive to cloxacillin or benzylpenicillin. But if there are gram-negatives among them, then you may have problems and you would rather have some of the other products. So we're finding out now how we're going to do that. There's on-farm culturing and all that type of stuff's coming on, and I'm not so sure how that's going to work out. I'm not worried about this. I'm not worried about working without third, fourth generation cephalosporins in mastitis. I'm not sure how this is going to work out. We're in the state of finding that out. So mastitis, clinical mastitis treatment, how to optimize that. First of all, of course, is prevention. And I'm not going to talk about it because it has been done earlier today and it has been done on other occasions, and there's so much to say about that I'll leave it to that word. First, of course, is prevention. But you have cases and then you have to treat them, and the important question is, or the important approach is, don't try to cure the incurable. I've seen so many cows, so many data of cows that have been infected for a long time and people still want to cure them and they want to have stronger antimicrobials, but that's not the question. The question is to treat or not to treat, to use or not to use antimicrobials. And that may be because there's no need for them, because the cow will cure itself, or that may be because there's not a chance to cure them anyway. And that's an important question to ask, rather than, is there anything stronger? Nowadays, there are all kinds of on-farm diagnostic tests available, and they do help. With Sandra here among the audience, and knowing that a lot of people from Canada have been working in this field on-farm testing, there's a lot available now. Minnesota, the Minnesota test, the Veto Rapid, Grom Agar, well, you can see them all, the Petri film. Different people in different universities are working on this, and there's a lot to say about it, but the basic is this. Farmers want to use them. One of my PhD students also is working in that field, and she did a study, and farmers do want to use them. If it's easy and doesn't take too long and isn't too expensive, then they want to use them. The quality of these tests generally is comparable to laboratory diagnostics. Recent paper out where it was compared again in +1, and some is a bit better than the other, but generally the results are pretty good. And by using them, the cure, there's no effect on days to clinical cure, on bacteriological cure, treatment failure is the same, and the number of new intramammary infections is the same, but the antimicrobial use does decrease. So there are possibilities here. And it's not for nothing that different companies are looking on how can I make on-farm tests that are easy, quick, easy to use, cheap, etc., because there's a big market there, I think. So that's a possibility. Talking about dry cow treatment, Anne asked me not to talk too much about it, but well, I couldn't resist telling a little bit about it. I've been the leader of the Dutch Udder Health Center, and we've been working for 6-7 years on trying to improve mastitis in the Netherlands, the udder health and mastitis situation in our country. And that was based basically on this 5-point scheme. Working on infectious pressure, working on host resistance in cows, working on milking milking treatment of cows, and on monitoring. And part of this was in those days, and I'm talking between say 15 and 8-9 years ago, part of this was blanket dry cow treatment. And I advocated for a lot of people that. And in 2006 we did a study that was published by Otto Sempimon in 2008 on a little study, or a little part of that study was how many, what was the prevalence of blanket dry cow treatment. And that was, what was it, 87%. And we were a bit disappointed because we had been so advocating this blanket dry cow treatment, and still there were a lot of farmers that didn't do that. And then suddenly things changed. And it was no longer allowed to have preventive use of antimicrobials. And then Christian Scherpenzeel came working with us, and he did his PhD specifically on selective dry cow treatment. And this is a short overview of what he found. He found that doing selective dry cow treatment, and we did a study in some 1,000 dairy cows in different herds where we did 2 teats with dry cow treatment and two teats without, and we compared. And we found, yes, clinical mastitis and subclinical mastitis increased in these quarters. And I recall very well that at some point in time we had to present it to the Secretary of State of Agriculture, presenting this study, trying to convince him that leaving blanket dry cow treatment would lead to mastitis problems, and we didn't want to do it. And then he said, okay, how are you going to solve that problem? Not saying that we could use blanket, because selective was the rule. No more preventive use of antimicrobials in healthy animals. So the next question was, how are you going to solve that problem of increased subclinical mastitis and clinical mastitis? So our study continued, and Christian found that the effects of these on mastitis were not that much influenced by the selection criteria. We published this also, you can read it, but we did different somatic cell count levels. We included mastitis history. We took somatic cell counts of the last 3 or 4 DHI data, all kind of things, but it all had an effect, but it was marginal. We also found that the effect at a herd level was very limited. You can have a little bit more clinical mastitis and a little bit more subclinical mastitis, but in all situations you had a significant reduction in antimicrobial use. The big thing though was that your general udder health would be improved. If your general udder health is better, you can survive with much less blanket dry cow, with much less dry cow antibiotics. And he also found that from an economic point of view, blanket dry cow treatment is not the optimum as long as your bulk somatic cell count is low. As long as your udder health is good, then it's economically more attractive to do selective dry cow treatment, which basically says that if your somatic cell count is high, you're buying off your costs by doing blanket dry cow treatment. And if you calculate that further on, there's much more gain, there's much more economic profit in improving your udder health, including less costs on dry cow tubes. So whether we liked it or not, it became obligatory in 2013. We worked on a guideline with our veterinary association on how to interpret selective dry cow treatment, what what cows were to be treated and which one could be left without dry cow antibiotics. That was launched in 2014, a year later. Selective dry cow was implemented quickly. In the same year already, 75% of the farmers implemented it in some way. Could be only a few cows without it, but could be all of them. Some of them did it a bit more. The antibiotic use decreased, but in the period after that, somatic cell count, bulk somatic cell count, as well as the mastitis situation, surprisingly improved. It got better. So here you see the percentage of cows dried off with antimicrobials. Here the whole thing started. It really decreased. The amount of antibiotics used for both dry cow therapy as well as mastitis therapy decreased. We expected in our calculations, in our models, that this would increase a little bit, but it didn't. It decreased. We saw that over the years, and we are monitoring that at GD, the bulk milk somatic cell count further decreased in spite of the fact that there was much less dry cow antibiotics used, as well as the number of cows with a high somatic cell count. There's one thing that worries me, and I'm going to show that in the next slide. We look in our monitoring specifically at the dry cow period. And what we do see is that over the last few years, there's a little increase in the percentage of, in the herds with more than 25% of cows which have a high somatic cell count after calving. So we see that there's from somewhere between 6 and 8% of herds that have more cows with a high somatic cell count directly after calving. So yes, the studies of Christian that he did on dry cow therapy were true. It does have an effect. We haven't done this for nothing. And yes, there is a risk in not preventing or in not preventing cows with antimicrobials during the dry period. And we see that in a number of herds where this problem occurs. And yes, we do see a number of herds where they have problems, where if they don't use blanket dry cow treatment. And if our people come there and then they can have a sort of an allowance that they do it for a certain period of time, as long as they change their management and try to get back to the better situation. Okay, what happened in the Netherlands? The total antimicrobial use, you may have seen this graph before, which had increased during the period as I showed you at the start of my presentation. It has decreased. This is the total antimicrobial use in all animal species. It's something that we're proud of to show, of course, but it was forced upon us. If the government wouldn't have forced us to work in the different sectors on this, I think it would never have happened. For those of you that are interested in what happened with those E. coli, those commensal E. coli that were in the stable, there was an increase during the years before 2007, 2008. This here is where it went down again. So it apparently has an effect. Coming to my conclusions. Antimicrobial use in animal husbandry is or can be decreased without negative consequences. We haven't seen it was a huge effort, but we haven't seen too many negative consequences of it. Yes, in some herds you see it happen, but it can be done. There's no reason to use critical importance antimicrobials in dairy cows. We've done it for years. It was easy to do. No withdrawal. You don't have to give attention to it. You pay and it's done, but there's no reason for it. Blanket dry cow treatment is no longer the standard. And that's in our part of the world. It's just forbidden in our country. But I see it's changing this side of the ocean also. I've been hearing people this morning about robots talking about electrical conductivity that may be useful in selective dry cow treatment. That type of thinking is coming up, and I'm eager to see what Ron's going to present on it in a few minutes. And for use during lactation, I would say to use or use, that's the question. That's a more important question than which type of antimicrobial to be used. And finally, keep monitoring. We're trying to do our best to decrease antimicrobial use in our country. We really do. We did a lot of effort in it, but we have to use a common sense. And if it runs out of hand, we still have our products available to use. And we want that to stay so in the future also. So keep monitoring at the national level or the provincial level, whatever you like, but also at the herd level. And with that, thanks for your attention. I'm happy to take any questions.